just quickly to introduce, I've come a long way to give this presentation from the other side of the planet. I work for CSIRO, and I'll just point out in the middle here, SIR, Scientific and Industrial Research Organization. We, at the heart of what we do, always look at how do we get something that we want to do out and into place in the market. And that was something that really struck us when we were getting into this area. And in the background, we also consider the impact of the science and technology more globally. And meeting the future demand for protein, we focused on poultry, because other than aquaculture, it's the most efficient way of making food for this growing world population. So I'll get through to the end to talk about something that we're doing in the poultry space, but I'll talk a little bit more generally about nutritional enhancement. What we're doing is in this space of editing, but others have used gene adding. And working in poultry, you've heard earlier in the day from Hossa, from Hendrix, of the partnership that we have there, and you'll hear more details of that immediately after this from Caitlin. But right now, what I want to talk about then is how do you go about enhancing the nutritional value of the foods that we eat? And so look, it's not all about eggs. There are other foods that we can eat. And altering that profile is either about adding benefit or removing harm. And adding benefit is about introducing something, introducing a new protein, or adjusting metabolism. And quite often those two are connected. Removing harm's about understanding the allergens in food and where the problems come from those and how to deal with that. Now, I asterisked adding protein, and I'll just throw this up because one of the things that's out there is this thing of muscle mass. And we know that many of the organizations out there that have concerns about gene technology believe that these animals are gene edited, and they're not. This is just a natural mutation in a gene that is involved in muscle growth. That's myostatin, and that is a targetable gene. You could make this, but we don't. As we've talked about, is productivity a key start point? Well, we believe no. We believe that we should be aiming at things that have a pull through for the public. What do the public want? Publics, what do members of the broader publics that were talked about before want? So the consumers of eggs in particular have two concerns. How did the egg get there, and what was in the process, and concerns over how they're kept, but also things in eggs that might upset them. And there are allergens that we'll talk about later. But in this space, there's ways of increasing muscle mass and editing out myostatin or leptin. Here's the regional fish and the Red Sea bream, and you can see a nice increase in the muscle mass, just like you see in this natural mutation, but in the fish. And that's great because it actually improves feed conversion efficiency and you get more per animal. But it's not really nutritional enhancement, it's just more of the same protein. So something where you've added something and it does have an effect is the issue around polyunsaturated fatty acids. So the polyunsaturated fatty acid pig model is something that was developed back in 2006, and that was based on using the FAT1, a fatty acid reductase that is found in C. elegans, introduced using SCNT and just a antibiotic resistance pressure to get an integration into the genome very successfully. It's been repeated since in China. So this was done in the University of Missouri. This has been done in China using CRISPR and HDR to put that gene very specifically into a safe harbor, the porcine Rosa 26 locus. That's a locus that's used in mice. It's also present in a number of mammals, including pigs. So this was a smart way of getting to this, a more directed way that you could regulate a bit better. And the benefits are fairly clear, that the omega-6 fatty acids include echinosoids and arachidonic acid. They're metabolites that are involved in inflammation. So lowering the ratio, and this enzyme drops the ratio, as you can see here, to increase the amount of omega-3, which is the healthy fatty acid. So this thing's out there, it's been done, but it's not yet coming through. This is obviously quite a while ago. So allergens, that's the only example I could find previously of something where you've got a really clear addition that changes a nutritional profile. and not in terms of protein. Now, allergens are an issue in food. In meat, there's three things that crop up. Pork cat syndrome, which is an interesting one where people who have a lot of contact with cats can get a response to cat serum albumin that's also has homology to porcine serum albumin, and they get pork cat syndrome. And then when they eat pork, they get really bad allergic reactions. Fish chicken syndrome is something that emerges, but these two are things that emerge, in adulthood, and they're things that we don't see in kids, but we see in people who've been exposed over longer periods of time. Fish chicken syndrome is a response to parvalbumin, enolase, and aldolase in fish and chicken meats that are different to our own, enough that you can mount an immune response. The last one, alpha-gal syndrome, is the one that's probably best characterized, and that's a response to a surface galactose residue, and it's actually something that's really important in transplantation. In milk, bovine lactoglobulin is the major allergen in milk that people with allergies to dairy products respond to, and eggs. There are proteins in egg white and egg yolk that are significant allergens. So the gal-safe pig for alpha-gal syndrome. Now, this can be used for food, but really the pointer was transplantation. But this is the thing that is one of the major causes of the rejection response of xenotransplantation of organs from pigs. And it's to do with glycoprotein galactosyl transferase alpha-1,3 gene, the GGTA1 gene, and knocking that out removes alpha-gal from animal tissues, from meat. Now, this was done and has been approved by the FDA by introducing a plasmid. This was done a long time ago, before CRISPR was up and going. It was done by introducing a plasmid with antibiotic resistance to neomycin that's expressed in eukaryotes. It was selected for in porcine fibroblasts to drive integration into this gene, selecting for dropout of that gene. The pigs exist, and they've been approved not just for transplantation, but also for food. Although the company Revivicor that undertook this work have basically said that's not their aim, but it is approved, could be used. It could be done much more elegantly now, obviously using CRISPR or TALENs to remove that gene, but the latest developments from that company are actually targeting a range of genes, including this and others, to really dramatically improve the transplantation efficiency. Not pointing at food though, still. Alpha-gal syndrome affects only about 35,000 people in the US. So the issue here is marketplace. Where's the big market for that? But in dairy, there's a lot of people that have allergies to dairy, and it's mostly driven by a response to bovine beta-lactoglobulin. And that is a gene that is accessible to being knocked out. So this is another edit to remove. And this was achieved back in 2018, reported from the group in New Zealand, Gertz Liebel's group, working with recombinetics, and Tad might be able to tell us a little bit more. That's Excelogen now. And using TALENs to get a homozygous deletion in this gene. And in fact, the dam that came through from that, this is the male dam up here, yielded milk that was free of beta-lactoglobulin. But once again, it's been done a little while ago, but it's not out there as a product. Eggs. So this is the area that we're interested in, the stuff that we have been focusing on in various ways. And in eggs, there are a series of allergens that are present in egg white and in the egg yolk. But the dominant and most abundant one is ovalbumin. It's the most abundant protein within egg white, and so isn't really accessible to deletion. You're going to end up with a very, very watery egg if you take that out. But some of the others are actually present in lower concentrations and are amenable to basically site-directed deletion. The objective that CSIRO has is to go through this process and generate a safer, low allergen egg. And an egg allergy is a significant food safety problem. You're not going to be able to eat cake. There's a lot of products out there that have egg protein in them as processed. Now, just think about that. No cake anymore. actually to disclaim a conflict of interest that happens to one of the key members of our team, Tim Doran. He's very happy of talking about this. His daughter suffers from an egg allergy. She's also allergic to dairy. And she's now turned 18 and still allergic. She's not had a proper cake. Her mum is great at making substitute cakes, but that's a big driver for him in this. But there's a huge marketplace for this. It is significant. About 2% of the population that respond to egg allergens, and there's a dominant one in there. Of the 4 key allergens, one of them survives heat treatment and cooking, and that's the key. A lot of these things are cooked, baked, and many of the allergens get denatured and you no longer respond to them, but one of them is resistant to that, and that's the target that we're going after. So what we're aiming to do, and this is starting at a small scale and building up within Australia as a first place to do this, is to create the first gene-edited animal food product on the Australian market, because this is very doable. We've assembled a team that includes genome engineers, food processing experts, and clinical studies people who work all within CSIRO, so one organization that can actually deliver all the things we need. The one thing that we can't do is the regulation of it, but we have been in conversation with the gene technology and food standards regulators in Australia. They're aware of this, and we'll work closely with them as we move this forward. And this is basically just an edit, a removal. So it's not introducing anything new. And under the revised gene technology regulations in Australia, that doesn't class as a GMO. That doesn't mean we won't talk with the regulator and seek their views on that material. However, what it does involve is changing the allergen profile in the food product, and therefore it will attract the attention of the Food Standards Organisation, Food Standards Australia, New Zealand, because one of the things that they are interested in is the presence of allergens. Now, predominantly when they wrote their food standard, it was about doing something with gene technology that creates a new allergen that might be a problem. And so that's what they're looking for. In this case, we'll undergo equivalence testing, and they'll be looking to say, is it an egg? And it's going to look like an egg, but one thing will be missing, but it's an allergen. And that means that we have changed the allergen profile, which means it will attract full regulation, which is a shame, but it's okay. It's one of the things you have to take on when you do these things. And interestingly, the Food Standards Australia New Zealand is currently reviewing the food standard to ask the question of itself, to what extent do we need to regulate these things? Because there's an attempt within Australia to harmonise how regulation works between the gene technology regulator and the food standards. And of course, in different countries around the world, this is different. Different institutions do either both or the two separately. And so once we get through this successfully, we'll have to look very closely. We've already started conversations with different people about how this will look in other countries. And it seems that because it's an edit to remove something, the barriers won't be so high, but we are changing our allergen profile. So that will attract some degree of attention. And that's it. Thanks very much for listening. I'm happy to take questions.